Every day, in sterile rooms shielded from the outside world, millions of operations take place. They are moments of profound vulnerability and incredible skill, where science, technology, and human hands converge to alter the course of a life. We hear the names: bypass, transplant, resection. But what really happens behind those closed doors? What is the intricate dance of precision and knowledge that allows a surgeon to repair the human body from the inside out? This is the world of surgery, a realm often shrouded in mystery and anxiety, but it is also a world of hope, innovation, and remarkable healing. To understand it is to appreciate one of the greatest achievements of modern medicine. We will journey inside the operating room, not to witness the graphic details, but to uncover the principles, the technology, and the incredible expertise that make these life-saving interventions possible. From the fundamental concepts that guide every incision to the robotic systems shaping the future, we will demystify the world of the surgeon. So, what exactly defines a medical operation? At its core, surgery is the art and science of treating diseases, injuries, and deformities by physical methods, primarily through incision and manual manipulation. We often use the term interchangeably with procedure, but there's a subtle distinction. A procedure can be as simple as drawing blood or performing a diagnostic scan. Surgery, however, typically implies a more significant intervention, one that involves cutting into tissue to repair, remove, or replace something within the body. Surgeries are broadly classified into two categories based on their urgency and complexity. Emergency surgeries are performed to address immediate, life-threatening conditions. A ruptured appendix, a severe trauma, or a sudden blockage of a vital artery. There's no time to waste. Elective surgeries, on the other hand, are planned in advance. They are medically necessary, but not an immediate crisis, allowing patients and their medical teams time to prepare. This could be a knee replacement to restore mobility, or the removal of a benign tumor. The patient's journey to the operating table is a carefully orchestrated process. It begins with a diagnosis, followed by a thorough discussion of options. The principle of informed consent is paramount. Patients must understand the why, how, risks, and alternatives before agreeing to proceed. On the day of the surgery, the anesthesiologist plays a critical role, administering medication that ensures the patient remains unconscious, pain-free, and stable throughout the operation. A state of controlled stillness that makes the surgeon's work possible. The field of surgery is vast, divided into specialties based on the part of the body or the type of condition being treated. Let's begin with one of the broadest and most foundational fields: general surgery. General surgeons are masters of the torso, dealing with a wide range of conditions affecting the abdominal organs. One of the most common procedures they perform is the appendectomy. The appendix, a small pouch attached to the large intestine, can become inflamed and infected, a condition known as appendicitis. If left untreated, it can rupture, causing a life-threatening infection. The surgery involves carefully isolating and removing the appendix, preventing a potential catastrophe. Another cornerstone of general surgery is hernia repair. A hernia occurs when an organ or tissue pushes through a weak spot in the surrounding muscle or connective tissue, often creating a noticeable bulge. Surgeons push the protruding tissue back into place and then reinforce the weakened wall, typically with a sterile surgical mesh, to prevent it from happening again. They also frequently perform cholecystectomies, the removal of the gallbladder, often due to painful gallstones. General surgeons are the versatile front line of the operating room. From the core of the body, we move to its engine, the heart. Cardiovascular surgery is a field of immense complexity and precision, focused on the heart and the vast network of blood vessels. When the coronary arteries that supply the heart with blood become dangerously clogged by plaque, surgeons perform a coronary artery bypass, graft. This is not about cleaning the blockage, but creating a detour around it. Surgeons take a healthy blood vessel from another part of the body, like the leg or chest, and graft it onto the heart, creating a new pathway for blood to flow freely and restore oxygen supply to the heart muscle. Within the heart itself, 4 valves act as one-way doors, ensuring blood flows in the correct direction. If a valve becomes diseased, either failing to open fully or close tightly, it can strain the heart. In a valve replacement surgery, the surgeon removes the damaged valve and sews a new one in its place. These replacement valves can be mechanical, engineered for durability, or biological, derived from animal tissue, each chosen to suit the patient's specific needs. These are intricate, open-heart procedures that require stopping the heart and placing the patient on a heart-lung machine, which temporarily takes over the function of breathing and circulating blood. Perhaps no field of surgery demands more delicacy than neurosurgery, which deals with the body's command center, the brain, spinal cord, and peripheral nerves. Neurosurgeons operate on the most complex and sensitive structures in the human body. When a tumor grows within the brain, the goal is to remove as much of it as possible without harming the surrounding healthy tissue that controls thought, movement, and sensation. Using incredibly detailed MRI and CT scans as a map, surgeons navigate the brain's intricate geography. They also perform complex spine stabilization procedures. After a traumatic injury or due to degenerative disease, vertebrae in the spine can become unstable, threatening the spinal cord. Neurosurgeons can fuse these vertebrae together using bone grafts and reinforce them with metal plates, rods, and screws, creating a rigid structure that protects the delicate nerves within. In recent years, procedures like deep brain stimulation have emerged, where tiny electrodes are implanted in specific areas of the brain to deliver electrical impulses, helping to manage the symptoms of conditions like Parkinson's disease. It is a testament to how surgery can modulate the very function of the nervous system. Our bodies are built on a framework of bone, and the specialty dedicated to this system is orthopedic surgery. Orthopedic surgeons repair injuries and treat conditions affecting the musculoskeletal system. One of the most transformative operations is joint replacement. Over time, the cartilage that cushions joints like the hip or knee can wear away due to arthritis, causing severe pain and limiting mobility. In a replacement surgery, the surgeon removes the damaged surfaces of the joint and replaces them with a highly engineered prosthesis, typically made from a combination of metal alloys and durable plastics. This new smooth surface allows the joint to move freely again, restoring function and dramatically improving quality of life. Orthopedic surgeons also perform fracture fixation. When a bone breaks, it needs to be held perfectly still to heal correctly. For complex fractures, surgeons will perform an open reduction and internal fixation, where they realign the broken pieces of bone and secure them in place with plates, screws, or rods. This internal hardware acts as a scaffold, holding the bone together while the body's natural healing process knits it back into a single, strong unit. For centuries, surgery meant large incisions, but a revolution has been underway, driven by the goal of achieving the same results with less trauma to the body. This is the world of minimally invasive surgery. The key technology here is the endoscope, a thin, flexible tube equipped with a light and a high-definition camera. When used in the abdomen, this technique is called laparoscopy. Instead of one large opening, the surgeon makes several small incisions, each just a few millimeters long. Through one port, they insert the laparoscope, which sends a magnified view of the inside of the body to a monitor in the operating room. Through the other ports, they insert specially designed, long, thin instruments. Watching the screen, the surgeon can perform complex procedures, like removing a gallbladder or repairing a hernia, with the same precision as open surgery. The benefits are significant: less pain, smaller scars, and a much faster recovery. Endoscopy uses a similar principle, but often follows natural pathways. An endoscope can be passed through the mouth to examine the esophagus and stomach, or through the colon to perform a colonoscopy, allowing doctors to find and even remove polyps without a single external incision. This is surgery through the keyhole, a paradigm shift that has redefined what's possible. The quest for greater precision has now led us to the next frontier: robotic-assisted surgery. It's important to clarify that the robot is not performing the surgery on its own. Instead, it is a highly advanced tool that extends the surgeon's capabilities. The surgeon sits at a console, often in the same room, viewing a high-definition 3D image from the camera inside the patient. Their hand movements are translated by a computer into incredibly precise, real-time movements of robotic arms docked over the patient. These arms hold the same tiny instruments used in laparoscopy, but with a crucial difference. They have wrists that can bend and rotate far beyond the capability of a human hand, allowing for unparalleled dexterity in tight spaces. Furthermore, the system offers motion scaling and tremor filtration. The surgeon can set the computer to scale down their movements, so a 1 centimeter hand movement at the console translates to a 1 millimeter movement inside the patient. The system also filters out the natural, tiny tremors present in every human hand, resulting in movements that are perfectly steady. This technology is not replacing the surgeon, it is enhancing their vision, their precision, and their control, pushing the boundaries of what is surgically achievable, especially in delicate procedures like prostatectomies and complex cardiac and gynecological operations. From the foundational principles to the cutting edge of robotics, the world of surgery is a continuous evolution, always striving for better, safer, and less invasive ways to heal the human body.